So I'm going to talk to you about the two joints of the hip region, starting with the sacroiliac joint. The osteology involved with this joint is going to be the sacrum, lateral portions, as well as anterior and posterior portions as well. Basically, this bone is just used fully this way. We also have the innominate bone, also known as the hip bone or pelvis. The superior portion is called the ilium. The inferior posterior portion is called the ischium, and the inferior anterior portion is called the pubis. And then the arthrology of this joint and allow it to function is going to be some rough articular surfaces, very irregular in shape, as well as the anterior sacroiliac ligament, the interosseous ligament, as well as the short and long posterior iliac ligaments, posterior sacroiliac ligaments as well. These are all responsible for providing the joint with nutation and counter-nutation. So to explain those a little bit further, there are two osteokinematic movements of the joint, and they're going to be nutation, for example, is going to be a anterior sacral iliac rotation, and then simultaneously a posterior iliac on sacral rotation, and then counter nutation is going to be simultaneously a posterior sacral on iliac rotation and an anterior iliac on sacral rotation. And then that can be absorbed through the sagittal plane of the medial lateral axis. The next joint is called the acetabulo-femoral joint. This joint is made up of the same bone, the innominate bone, the pelvis bone, the hip bone, whatever you may call it. The three regions that make up that, the ilium, ischium, and the pubis, they make up what's called the acetabellum. That's the fossa in which the proximal portion of the femur sticks in to make up this joint, and the proximal portion of the femur is consisted of the femoral head, neck, greater and lesser trochanter, as well as the linea aspera. And the arthrology involved with the acetabulo-femoral joints going to be, for one, the acetabular fossa, which provides room for basically this joint to move, this joint to function. Next is the acetabular labrum. This just provides a little bit of extra cushioning of the joint and allow it for a little bit more stabilization. Next is going to be the lunate surface. This surface provides a little bit of friction absorption and a little bit of lubrication so that this joint can move flawlessly, whatnot. Next is going to be the ligamentum teres. This just provides a little bit of extra stabilization just there, just in case anything goes wrong. And then next is a pretty important one, is the iliofemoral joint, iliofemoral ligament. This ligament is pretty important. It's responsible for preventing any excessive rotation or translation. Basically prevents your joint from being hyperextended, which we definitely don't want. And then next is the ischiofemoral ligament, which is responsible for also preventing some excessive rotation, as well as some excessive AB and abduction of the joint, just preventing anything like that from happening so we're not getting injured. And then last is the transverse acetabellum ligament, acetabular ligament, and this is responsible for a little bit of extra stability and a little bit of extra comfort to help this joint function. And then last but not least, we have the osteokinematics of the acetabulo-femoral joint, which is going to be some flexion and extension, and the flexion and extension can be observed through the sagittal plane of the medial lateral axis. Next is AB and adduction. This can be observed through the frontal plane of the anteroposterior axis. And last is internal and external rotation of the acetabulo-femoral joint. And this can be observed through the transverse plane of the medial longitudinal axis. So that basically covers the two joints of the hip region, and I hope that this helps you get a better understanding. Thank you.